And this is actually a good thing, because the endocrine system chart and the repro chart do show the ovary, okay? And they actually show stages of follicle development. I'm not going to ask you any follicle development stages on those charts at all. And could I point a pen to the ovary, ask you what it is? Sure, okay. As far as follicle stages, it's going to be here. So that's the reason I want to show this to everybody. It's a good model, but the only downside to it is it attempts to show all the follicles stages at the same time. You never ever see them all at the same time. Okay, so it's going to look like I'm kind of jumping around, but I'm not. So let's just go ahead and hit this. I'm going to not really fill in a lot of details physiologically, because we did that in the lecture earlier. So when I said that there was like an epithelial coating on the outside of the ovary, I was dead serious about that. I think it's wrong to call it visceral peritoneum. And if you call it that on the exam, I'm not. If you do call it that on the exam, I'm not going to mark it wrong, because that's what she has in the manual. Okay. But most people call this germinal epithelium. It's just like a cuboidal epithelial coating on the outside of the ovary. And then right beneath that, there's like a connective tissue shell, and that's called tunic albuginea. And the testis of the male has the same thing. Okay, and it makes sense. You know, if these are homologous structures, you can have tunic albuginea in both the ovary and in the testis. So if we're like dissecting into the ovary, we would go through the epithelium, through the tunic albuginea, then we'd be at the actual functioning tissues of the ovary. And we divide them into the cortex that's out here, that has your different follicle stages in it, and then the deeper tissue would be the medulla. That's where the big blood vessels are. Okay. You know, I mentioned broad ligament when we did the overheads. Broad ligaments like everywhere. It supports the ovary, fallopian tube, uterus. This is a part of the broad ligament. Happens to be called mesovarium. You don't have to know that. I just want to point out how complex the broad ligament is. This structure right here is the ovarian ligament. I think she does have that in the manual. So I could put a pen, ask you that. Okay, as far as follicle stages are concerned, like I said, it's going to appear to be kind of jumping around. Sorry about that. But around the age of puberty, we're going to have 200 to 400,000 primordial follicles out here in the cortex. On this model, they only show a couple clusters of them. They show some here, they show some over here. So let's just say, for the sake of argument, these are the primary follicles that respond to FSH. Okay, so this particular month, it's going to be these follicles and this ovary that will respond. So they're going to start to develop. And as they develop, obviously they're going to get bigger. They're going to go through about that size, and then maybe that size. Of the dozen or so that started to respond to FSH, typically one goes the whole way. Okay, on about day 15, it becomes a tertiary follicle or Graafian follicle. And like I said, it's sitting in on the surface of the ovary, kind of like a blister, ready to pop open. Okay. What about the other follicles that started to develop? Well, they become aphoretic, and that simply means they start to disintegrate. And you probably can't see this from where you are, but if you look at these growing stages, those two still have very discernible nuclei. That one, the nucleus is like exploded. Okay, this is an aphoretic follicle. It's getting ready to just go by the wayside. Okay, so anyway, here we are, day 14, day 15. We have our tertiary follicle, or Graafian follicle, on the ovary like a blister. This is sort of an odd model in the sense that it actually captures the follicle in the process of ovulating. So in other words, this little structure here being spit out is the ovum. Actually, I use that term with some trepidation. I'll explain why in a minute. Prior to ovulation, the ovum is in a little compartment on the back side of the follicle. And I would have preferred it had they shown it that way, but they decided not to. So this is just a follicle in the process of ovulating. The reason I hesitate to call this ovum is that technically it's not an ovum yet. I mean, technically, we don't get development of the ovum until the sperm penetrates the covering of the ovum. Then there are some things that occur that cause it to become an actual ovum. It gets pretty detailed. But I'm going to just I'm going to say, okay, the ovum is expelled on about day 15. Where do we go from there? the empty follicle fills with blood, and it becomes that. That's corpus hemorrhagicum. Good name for it is full of blood. Almost immediately, your corpus hemorrhagicum seals off, the blood is absorbed, and this becomes a powerful endocrine gland. That is the corpus luteum. Pumps out progesterone in high concentration, smaller concentrations of estrogen. They give you the post-ovulatory thickening of the endometrium, exert negative feedback suppression of the hypothalamus, just like we talked about before. So if the cycle is non-fertile, what will happen is, almost like clockwork, on about day 24, the corpus luteum is going to die, and it's going to become scar tissue called corpus albicans. So you're going to go from here to here. My understanding is when the corpus albicans first forms, it's pretty big, but then it gets smaller with time. But it's permanent scar tissue. And so what they've done with this model is they've shown, like that is corpus albicans, here's one that's a little bit older, here's one that they section open. It's all scar tissue, okay? And like I said, it's permanent. So what we should be able to do is take the ovary from a cadaver, and if we do a very detailed serial study, we can count the number of corpus albicans that are there and dictate or determine how many times it ovulated. So that's the ovary model. Like I said, this is the only one I would consider using to ask you follicle stages on. I'm tempted to have everybody go over the chart to do the spermatocyte thing, but I drew a picture. If you want me to go to the chart, I will. But I think my picture is pretty.
Go to the chart. Go to the chart.
Well, at least let me tell you what my picture shows. what the picture shows is it's a cross section of the seminiferous tubule, and I mean, if you make a thin section through the testis, you're going to probably catch the same tubule like at several different points in cross section. So here's one of those. The reason that this was shown on the endo chart is the endo chart wanted to feature the interstitial cells that are in between the seminiferous tubules. They produce the androgen, okay? But that chart also shows the stages in spermatogenesis. And the reason I want you to look at my chalk diagram is it just shows the design. It's like a really clever design. Spermatogenesis is meiotic production of sperm. And so we're going to start out with a parent type cell. Those are those big yellow circles here. They're big diploid cells called spermatogonia. Okay, so stimulated by FSH from the anterior pituitary, spermatogenesis is going to get underway. The spermatogonia will divide, and the daughter cells that they produce move one step closer to the center of the tubule. Those will then constitute primary spermatocytes. Then as they divide, their daughter cells are secondary spermatocytes. And guess what? The chromosome number is now down to 23. So your reduction division occurs from primary to secondary. And then the secondary spermatocytes split or divide into spermatids. And the easiest way I can describe those to you is they look like little tadpoles. You know how tadpoles have like a fleshy tail? If you see a membranous protrusion from the tail, it's still a spermatid. And then as that membrane disappears, then you have the sperm. Now, can that sperm fertilize an egg right now? No, because it's not mature yet. It's got to mature in the epididymis. We'll walk over and I'll confirm you guys know this on the chart in a minute. Notice I drew some big blue cells out here. Some folks were asking me about those. They're referred to as sustentacular cells, which is really hard to say. Some people call them Sertoli cells, nurse cells, as in nurse, taking care of a patient. That's a good name for those. Martini actually devotes almost a full page to talking about what sustentacular cells do. We're not going to hold you for any details on that at all, other than to say that they do all kinds